Hello, I'm Sara Tribe Clark, Director of the Eldercare Locator and the new Disability Information and Access Line. And today I'll be talking about two national call centers supported by the Administration for Community Living, or ACL, and administered by US Aging. While I'm on this slide, I'd like to mention that we've rebranded. US Aging, formerly N4A, is still the national association representing and supporting the network of area agencies on aging and advocating for the Title VI Native American aging programs. We and our members help older adults and people with disabilities throughout the United States live with optimal health, well-being, independence, and dignity in their own homes and communities. To provide some context for the two national call centers and to make sure you're aware of some of the features on the Eldercare Locator website, I'll be talking through key elements of the Aging Network and the range of services area agencies on aging offer. I'll also discuss our new national call center developed for people with disabilities called the Disability Information and Access Line, or DIAL. An excellent starting point to give you a sense for the Aging Network and primary entities that the Eldercare Locator refers to is the Older Americans Act. This is really the foundational core of the Aging Network as we know it today. It was signed into law in 1965, the same summer that Medicare and Medicaid were also passed by Congress. This slide shows a famous photo of Lyndon Johnson signing the Older Americans Act into law, all part of a plan to help support Americans as they age. In 1973, the Older Americans Act was amended to include the designation of Area Agencies on Aging, or AAAs, as part of a plan to get the federal funds all the way to the local level for easy access by older Americans and to allow local entities to have some say in how the funds were spent. Most of the Act applies to people age 60 or older, though it also targets services to the most frail and vulnerable Americans. Special populations noted in the Older Americans Act are also veterans, minorities, or historically marginalized groups, people with low income and limited English proficiency. The Aging Network, which is funded under the Administration on Aging, is part of the U.S. Administration for Community Living, or ACL. The Older Americans Act established a national network of federal, state, and local agencies to plan and provide services that help older adults to live independently in their homes and communities. This interconnected structure of agencies is known as the Aging Network. So bringing it back to the Eldercare Locator, we're a resource funded by ACL that lists agencies within the Aging Network comprised of local area agencies on aging, Title VI Native American aging programs, and state agencies on aging. People can get connected to their state and local agencies by going to the Eldercare Locator website or by calling us. This slide shows 4 graphics meant to illustrate the progressively more local levels of the Aging Network. So moving from left to right on this slide is federal, state, area agencies on aging, and local service providers. At the federal level, the U.S. Administration for Community Living provides direct funding to states based on the number of people over the age of 60 in each state. 56 state units on aging receive the funds and provide it to 622 AAAs nationally, again based on the number of people over 60 in each community or catchment area. The AAAs then develop a plan for the provision of local services and contract the delivery of many, though not all, of the services out to local service providers. Most states are divided into planning and service areas, or PSAs, sometimes referred to as the catchment area, so that programs can be tailored to meet the specific needs of older people residing in those areas. The extra 6 state units on aging, which some people ask, are the District of Columbia, Guam, Puerto Rico, American Samoa, Mariana Islands, and the Virgin Islands. All AAAs are involved in planning, developing, coordinating, and delivering a wide range of services and supports in each local planning and service area. Partnerships are critical to AAAs and the delivery of responsive, high-quality supports, and many work with other aging and disability-focused organizations and programs in the implementation of programs and services. To name a few frequent local partner organizations, there's the Alzheimer's Association chapters aging and disability resource centers, state health insurance assistance programs, and centers for independent living, among many, many other community-based organizations. This slide illustrates the 5 core services that area agencies on aging are authorized by the Older Americans Act to offer: elder rights, caregivers, nutrition, health and wellness, and supportive services. Elder rights programs include long-term care ombudsman programs, which advocate for people who reside in long-term care settings, and in some cases, home and community-based settings with using Medicaid funds, and elder abuse prevention programs. AAAs generally provide, either directly or by contract, an average of 7 elder abuse prevention or intervention services. The second is programs for caregivers, which may include respite programs, support groups, and various types of training. Nutrition programs, which most commonly is both community congregate meals and home-delivered meals. Health and wellness programs, so for example, senior wellness center programming, exercise classes, and other opportunities for socialization. The fifth is supportive services, and examples are information and referral services, including referral to in-home assistance, case management, transportation, and home modification. AAAs contract with local service providers to deliver many of these aging services. For example, home-delivered meals, transportation, legal services, and in-home services. Though there's others. There's not a local provider who can offer. If there's not a local provider who can offer the services, the AAA generally operates it directly, which often happens in rural areas. However, it should be noted that most AAAs manage their own information and referral programs, case management, and caregiver support. Other key services frequently available through AAAs, though not authorized specifically by the Older Americans Act, are listed on this slide. These are listed on the Eldercare Locator website as well, with explanations for each. So adult day health, financial assistance, home health, personal care and respite care, as well as senior housing options, senior care programs, telephone reassurance, transportation, and volunteer services. AAAs frequently have partnerships to assist with fulfilling the mandated Older Americans Act services, as well as other services and supports. This slide shows some of the most common partnerships between AAAs and other human service entities. To read through a few, on the human services side, adult protective services, transportation agencies, Medicaid agencies, mental health, disability service, and emergency preparedness agencies, and other community supports might include hospitals, faith-based organizations, community health providers, managed care, or other businesses such as restaurants. So if you're referring to a AAA, there's a good chance the person you're referring will have access to many other local resources and organizations well beyond the AAA itself. This is also where AAAs partner with or refer to state and local services for people who are blind, vision impaired, or progressing in the direction of needing assistive services or technology beyond glasses due to more recent age-related vision loss. So while not all AAAs will know of blind services in their local area, vision loss is common enough among older adults that they'll likely have some standard resources that they refer to. So if you're from an organization that serves people who are blind, definitely seek out your AAA's director and suggest partnering, at least to make sure that their case managers know about you and can share your resources if needed. Title VI Native American programs were created by the 1978 amendments to the Older Americans Act. The Administration on Aging makes grants to federally recognized Indian tribes based on the number of elders who are 60 years of age and older. The Title VI programs promote the delivery of supportive and nutrition services to American Indians and Native Alaskan elders. These programs also provide support to caregivers of older people and grandparents raising grandchildren. The University of North Dakota administers the National Resource Center on Native American Aging. They maintain the Native Services Locator that's linked to the Eldercare Locator website, both within local database service listings for areas that have Indian tribes and others, and on our website as well. And the link is also noted here on the slide. While older adults are the population most likely to reach out to the Eldercare Locator, the Aging Network serves a broad range of consumers and caregivers under the age of 60. This slide shows a breakdown of the most frequent Aging Network consumers under 60. 85% of AAAs report serving clients with a disability or chronic illness under 60. 78% of AAAs serve caregivers of all ages, including under 65. And 66% of AAAs serve veterans of all ages. In the next couple slides, we'll review 2 additional key resources besides AAAs to be aware of for younger adults with disabilities. Aging and Disability Resource Centers, or ADRCs, are a resource on the Eldercare Locator database resource listings, frequently with the same contact information as the AAA. The ADRC initiative is a collaborative effort of the U.S. Administration for Community Living, Centers for Medicare and Medicaid Services, or CMS, and the Veterans Health Administration. Launched in 2003, the concept of ADRCs was to streamline access to long-term care information and services for people of all ages and incomes, with the understanding that people prefer to live in their own homes. However, this is only possible if the necessary services and supports are accessible, so if people can find them. So the concept of ADRCs was to make all of the long-term services and support information, which is frequently confusing and hard to find, accessible via the ADRC, which would have an information and referral component, and the staff would be prepared to complete referrals to both local aging and disability resources, and in many cases even facilitate Medicaid intake and assessments in collaboration with other state agencies. So the majority of ADRCs are housed within or operated by area agencies on aging. So this is why in the Eldercare Locator database, ADRC's contact information is frequently the same as AAA's. And while not all Eldercare Locator database entries list ADRCs, you can feel confident that if they do, their information and referral team will be prepared to field calls from younger adults with disabilities. Centers for Independent Living are an important resource to be aware of, and you can search the directory of Centers for Independent Living to find them. So Independent Living Research Utilization, or ILRU's website, is listed on this slide, and CILs, or Centers for Independent Living, are consumer-controlled, community-based, cross-disability, non-residential, private, nonprofit agencies that are designated and operated within a local community by individuals with disabilities, and they provide an array of independent living services. At minimum, 51% of staff are people with disabilities, and 51% of board directors are persons with significant disabilities. A CIL provides at minimum the following core services: information and referral, independent living skills training, individual and systems advocacy, peer counseling, transition assistance from nursing homes and other institutions to community-based residences, and they assist individuals to avoid institutional placement. And also transition of youth with significant disabilities after completion of the secondary education to a post-secondary life. So they have a lot of work on their plate, and they're an important resource for people with disabilities under 60. Now let's shift back to the Eldercare Locator. Again, an ACL-funded resource that helps connect people with local, federally funded agencies in their own states, towns, and neighborhoods. We can be contacted via phone, email, or chat, which is accessible on our website. Our contact information is noted here on this slide, so email is eldercarelocator@usaging.org. eChat is accessible via our website, eldercare.acl.gov, and our phone number is 800-677-1116. The Eldercare Locator runs a Washington, D.C. based call center, which generally operates Monday through Friday, 9 a.m. to 8 p.m. Eastern. However, callers can receive assistance after hours through our voice prompt system, which allows callers to connect directly to local agencies even if the Eldercare Locator specialist is not available. We generally receive between 26,000 and 36,000 calls per month from every state, the District of Columbia, and U.S. territories. You can also find us on social media, both Facebook at Eldercare Locator, all one word, and Twitter at Eldercare Loc, or Eldercare LOC, all one word. If people prefer, they can go directly to our website, again, eldercare.acl.gov, to get connected to their local aging and disability resources. So this is often the preferred method for professionals seeking quick contact information. So it's the most frequently used aspect of our website. It's the agency lookup feature. So the current slide shows our home page, including a white bar at the top and an arrow pointing to it for entering either your zip code or written out the city and state. So my understanding is many of the attendees on today may already use this feature, but if not, take a minute to pull up our website now, put in your own zip code, and test it out. Hopefully you'll recognize the information that comes up. And of course, let me know if the information that you find in the database appears to be incorrect or incomplete, or if you hear back from a caller that you've referred that they weren't able to get through. And then we're generally able to update those contacts very quickly, within one business day, if not the hour that we find out. Once you've pulled up the contact information for your area, you will see some or all of the 9 possible ACL-supported resources available in our database for every community in the country. Information and referral assistance, aging and disability resource centers, area agencies on aging, Title VI, American Indian, Alaskan Native, and Native Hawaiian programs, state units on aging, elder abuse prevention, health insurance counseling, legal service program, and long-term care ombudsman. While not every community has ADRCs or Title VI programs for Native Americans, they will be listed for those that do. The first item on this list and the first resource to come up in the Eldercare Locator database for each zip code or city is information and referral assistance. This is because AAA's information and referral assistance numbers can connect callers to all of the other resources on this list. So we do recommend that, connecting with the AAA through their information and referral number. That ensures the full range of supports are available to the caller. However, you may also choose to call just one of the listed programs directly. For example, if you know you want to connect directly with Adult Protective Services, Health Insurance Assistance, Legal Services, or Long-Term Care Ombudsman, those last 4 on the list, usually they're the most likely to have a different number than the AAA, although in some cases along the whole database it's all the same contact number. So it varies widely by locale. The last item I want to touch on related to the Eldercare Locator is our Home for the Holidays campaign. It's currently underway. Home for the Holidays is an annual consumer-focused campaign that highlights an important issue facing older adults and provides consumer-friendly tools that can be used throughout the aging network and beyond to help start sometimes difficult conversations and that need to take place among families during the holidays. Also, as part of the campaign, U.S. Aging conducts significant media outreach to elevate the issue at a national level, earn media, and spotlight how the aging network can help older adults, caregivers, and families address that topic. The centerpiece of the campaign is a consumer brochure that provides useful information to older adults, caregivers, and families on each year's chosen topic. So just a few of the most recent brochures I have up on the screen now. Living Well with Dementia in the Community. This was completed in partnership with the Alzheimer's Association and Dementia Friendly America. The next is Caring Across the Miles, a resource for long-distance caregivers. And the third image of a brochure on the screen is Staying Connected and Healthy During the Pandemic. And this is related to social engagement during COVID-19. All of Eldercare Locator's brochures are accessible on our website by clicking on Resources at the top right corner, Consumer Publications, and then Brochures for a full list. Hard copies of many of our brochures can be ordered through an online store, or PDFs can be pulled directly from our website and printed as needed. This year's brochure is titled Healthy Aging in a Pandemic World, What Older Adults and Caregivers Need to Know Now. After nearly 2 years of taking precautionary measures to stay safe and healthy during COVID-19, older adults who are re-engaging with one another, their families and friends and communities may need advice on where to turn for assistance with changes they've experienced during the pandemic. Developed with this in mind, the campaign encourages older adults and caregivers to take stock of their health and safety, consider any needed changes to their lives or environment, and connect with the Eldercare Locator and their local AAA directly to get more information on services available in their communities that can help address these changes. And just a few of the listed changes within the brochure: changes to physical condition, environmental changes needed to the home, in-home support, changes in social connections, and changes that impact safety and security. In addition to the brochure, each year we produce a toolkit to help organizations serving older adults participate in the campaign by highlighting their programs. The toolkit includes sample social media posts, graphics that can be used on social media, a template newsletter, article, and a press release. All of these can be used by organizations that are delivering these services on the ground in their communities. Our goal with the toolkit is to support agencies as they promote their programs during this campaign and beyond. All of the Home for the Holidays promotional materials can be found on our webpage. That's usaging.org/H4H2021. I'd like to transition now to our new call center, but first for a little background. To assist older adults and people with disabilities in accessing vaccines, back in March 2021, President Biden announced that an additional $100 million had been allocated to the CDC, Centers for Disease Control and Prevention, to support the efforts of the Aging and Disability Networks in assisting with vaccine access. As part of an unprecedented partnership between CDC and ACL, U.S. Aging received supplemental funding from ACL to both increase the capacity of our Eldercare Locator call center and develop a new call center focused on vaccine access for people with disabilities. So some examples of what they were aiming to help people with were support with appointment access, such as scheduling, transportation, companion or peer support, and also figuring out whether in-home vaccination is available in someone's area. So moving on now to the Disability Information and Access Line portion of our presentation. The COVID-19 pandemic highlighted the need for a national call center for people with disabilities. When compared to the general population, people with disabilities have an elevated risk of serious illness and death due to COVID-19 and are getting vaccinated at a significantly lower rate than older adults and the general population. ACL and CDC were tasked to facilitate the helpline we now know as DIAL to help connect individuals with disabilities and their families with the information and support they need to stay healthy during the COVID-19 pandemic. Between June 1st and January 31st, the time of this recording, DIAL had received more than 25,000 contacts via both calls and emails. Prior to December 2021, weekly DIAL call volume was ranging between 250 to 350 contacts per week. However, since December 1st and the dissemination of Social Security Administration's Cost of Living Increase letters, or COLA letters, on which DIAL was mentioned, we're now up to 2,000 to 4,000 calls per week. While DIAL's initial intent was to provide support for people around COVID-19 vaccine information and resources, we also frequently field calls on a wide range of home and community-based supports for people with disabilities as well. So as an example, legal assistance, housing options, financial assistance, in-home services, independent living, transportation, peer counseling, disability rights, food access, and employment, to name a few. Those are the most frequent referrals besides COVID-19 information. Here are a list of partners that have helped make DIAL a reality. The Association of Programs for Rural Independent Living, or APRIL, Association of University Centers on Disabilities, AUCD, Independent Living Research Utilization, ILRU, the National Association of Councils on Developmental Disabilities, NACDD, the National Council on Independent Living, or NICL, National Disability Rights Network, NDRN, and the Partnership for Inclusive Disaster Strategies. Leaders within these disability organizations have helped ensure that we took several unique elements of disability culture and needs into consideration as we completed the initial and very quick setup of a call center and prepared to involve the disability community in promotion of that call center. The partner organizations are primarily federally funded national associations for ACL grantees, including Centers for Independent Living, University Centers for Excellence in Developmental Disabilities, or UCEDs, State Protection and Advocacy Systems, PNAs, and Councils on Developmental Disabilities, or DD councils. Current partners have assisted with naming the new call center, also initial and ongoing training of Dial call center specialists, developing quick reference scripts and a decision tree for how to refer Dial contacts, keeping databases current, promoting Dial, assistance reaching out to potential Dial employees with disabilities and/or with prior disability advocacy experience. We're currently working on expanding this list of partners to ensure we're inclusive of people with the widest possible range of abilities and needs to make sure we're providing the most appropriate resources and promoting Dial in the most effective ways possible. Our partnership with Older Individuals Who Are Blind Technical Assistance Center is a perfect example of our collaboration with an organization that supports a specific population of people with disabilities. As part of a training exchange between our two organizations, Eldercare Locator and Dial staff participated in a training presentation by the Technical Assistance Center covering resources for people who are blind. While we refer to many other national resources, depending on the details of our callers are seeking, Dial's most frequent referrals to disability organizations are to Centers for Independent Living, that's actually about 32% of our calls, Aging and Disability Resource Centers, Councils for Developmental Disabilities, State Protection and Advocacy Systems, and UCEDs. Other COVID-related referrals tend to go to local health departments, vaccine.gov website, state COVID lines, state health departments, and also area agencies on aging. And for each call we receive, we listen to the person's description of who they are, what they need, where they live, and then work to connect them with multiple referrals that will assist them. We probe to make sure we're understanding the full breadth of their needs, and for example, if they're asking about a vaccine appointment scheduling, and have mentioned using a wheelchair, we'll not just find them an appointment online, but connect them with their local Center for Independent Living and or ADRC to get a better sense for the most accessible vaccination site in their area. We also figure out whether they're able to take down information from multiple referrals or if they prefer to start with just one. We offer to connect them directly and or assist with leaving a voicemail if they'd rather do that. We've really found that because of COVID-related telework, agencies are still more likely than before the pandemic to require people to leave a voicemail, which we've found that not everyone wants to do or is able to do. So we're able to assist with that. Dial staff and partners are currently working with a marketing firm to develop materials to reach a much broader range of individuals with disabilities than we've been able to reach in the past, especially for those that are part of underserved populations, communities of color, and or those who live in areas with very low vaccination rates. So we've conducted a focus group, a market survey to people with disabilities, all to ensure effective targeted marketing. Our social media was launched on January 3rd, and we received coverage from ABC News via website article, which I can share, and we expect to release this month the first round of marketing deliverables. We have mat releases, or advertisements for placement in publications and media coverage, updated social media toolkits, and video and radio PSAs should all be coming out in the month of February. If you'd like to learn more about Dial and or share this information with your staff, with colleagues, or with friends and family, you can go to the webpage noted on this slide. So it's usaging.org/dial-connect, all one word. You can download our initial social media and newsletter templates and share them widely. You can find a video recording of a September 14th National Dial webinar along with PowerPoint slides. And we expect our list of shareable materials to be expanding quickly, but this is at least a start that'll help you share the information right away. This slide has Dial's contact information. So our phone number is 888-677-1199. Our email is dial@usaginganddisability.org. Our webpage is acl.gov/dial. And our hours of operation are Monday through Friday, 9 a.m. to 8 p.m. Eastern. Same as our Eldercare Locator hours. And with that, Thank you so much. I look forward to continuing this important partnership and making sure our call centers are serving people who are blind or have low vision in the best way we possibly can. Thank you.